Welcome back to Insight. We're at the health insurance shop here on Lake Avenue, and we're with Gus and Chrissy. And open enrollment starts for most people, I guess everybody, on Saturday. And you guys are going to be here doing business, helping people get the insurance policy that they need, correct?
That's correct. We will be open for business. We've already got a number of clients who are coming in. They've got appointments scheduled. So we typically aren't open on Saturdays, but because of the short time frame that we have this year with open enrollment and the number of people that we're going to be helping through the process, we're definitely going to be open on Saturday and probably most Saturdays throughout the open enrollment season.
So if people have insurance questions, they are not happy with the insurance that they have, they don't maybe even have insurance right now, you guys, when they call you or come in and see you, how does that process work? You guys can do what for them?
Well, we can look at plans, we can run numbers, we can see if they qualify for tax credit, cost share, also guaranteed issue. You know, we can let them know pre-existing no longer applies.
So if they've had trouble in the past with insurance, that maybe even have been turned down for health insurance, that those issues are gone.
That's
now
correct.
It's just really kind of finding the right fit to get them into the right doctor, the right hospital, things like that, right?
Yes.
Yeah, typically the Affordable Care Act simplified a lot of what we do in that, you know, for the most part, every policy is guaranteed issue. They all cover pre-existing conditions from day one. The rates are community rates, so, you know, in the past we've had to, you know, try to determine if somebody had a health issue and then factor that into what additional cost might be involved. Today the rates are the rates are the rates. So essentially, even though community rates essentially mean that if we both live in the same zip code, same county, and we buy the same plan at the same time, if we're both the same age, male or female is irrelevant anymore, meaning that the rates are the same. Then basically one of us may not pay full price. Basically one of the major components to the actual cost that the consumer is going to pay is based on their household income.
Okay, so these all need to kind of go into what it is, you know, how I'm going to get health insurance, you know, income and things like that. But the question for you guys, when I come in here, your services are free to me, the consumer, right?
Correct.
Yeah, so I mean, why in the world would I try to do this on my own or go to a website when I can actually talk to a person who does this all the time?
Exactly.
Well, we've been in business for, well, since 1977, so for quite a long time. All we do is health insurance. That's all we've really done from the very beginning. And Chrissy, you've been in the business now for 19
years.
And we're very well versed on how these products work and the differences between one insurance carrier and another, and which doctors are contracted with one versus the other. And we try to help an individual find the plan that's going to best serve the needs of them and or their families. The rate is the rate is the rate, so it doesn't matter whether somebody tries to do it on their own or comes in and has assistance from somebody like us. They're going to definitely get a much higher level of service here. It doesn't cost them a nickel more.
That's absolutely right. If you want more information, go to their webpage and you can find out more about the buyhealthinsurancehere.com. That's the webpage. The health insurance shop. Give them a call at 484-7010. We'll be right back on Insight.